Hello everyone, thank you for joining me today on December 9th, 2020. I would like to introduce myself. My name is Jordan Stimulis and I am the new Executive Director of Healthy Community Brookfield, HCB, here to present Healthy Community Brookfield's proposal. So today's presentation goals, I hope the content of my proposal will educate board members about the current environmental factors of HCB. We will also cover the results of a recently conducted situational analysis and the organization's current standing among the community and key stakeholders. Finally, I hope the strategies and tactics presented today will be thoughtfully considered as we discuss the future success of HCB. With these goals in mind, the top priority of today is to gain your support as board members to launch a comprehensive strategic plan for the new year of 2021. To begin, let's establish who HCB is and what we do today. As a not-for-profit charitable organization, our 97 employees and dedicated board of directors aspire to promote a public health and wellness in our Midwestern county of Brookfield. We do this through our traditional public programs that are contracted through the county and the state that help those in need of services. Such services include women's health, violence prevention programs, vaccine and immunization services, and so many more. So let's go over some environmental factors. According to a recent case study, external organization factors show that there is a severe lack of understanding as to what the organization actually does, who we are affiliated with, and whether or not we are upholding our true mission with the programs available. Explicitly speaking, HCB's present community relation issue stems from a long-standing lack of communication between the organization and community members. This, along with current programming strategies and the organization allocation of resources, contribute to the overall confusion and frustration actively communicated by community stakeholders. Despite the community's perception of HCB as doing overall good, it is imperative a clear line of communication needs to be established between the organization and its community members, and the effective partnerships developed must use the 9 guiding principles of community engagement. Finally, constituency development needs to be prioritized as tasks are carried out using the categories of structural capacity in order to develop relationships with community members who benefit from or have influence over the community's public health actions. So let's take a look at the situational analysis. The purpose of the situational analysis is to provide, as it says, quote, a clear, easy to read map of internal and external factors that may help or harm a project. So essentially, we are looking at the strengths, weaknesses, opportunities, and threats. We want to match our strengths and opportunities so we can go after those opportunities and the way that we know what we can do. We want to match our weaknesses with our strengths to offset any weaknesses, and we want to match opportunities with threats to offset threats with opportunities. So by having a strong commitment to improvement of community health and health practices, the dedicated board of directors and senior staff at HCB can harness their willingness to coordinate the organization's efforts towards increasing the availability of funding. These strengths will overall improve HCB's provision of programs and services to the community through dedicated internal direction by using resources that will contribute to its success. This is just an example of one of our strengths. You can take a further look at this later if you need to. So I wanted to go over the current mission and vision that we have at HCB right now and a proposed mission and vision. So with a mission, we want the what and the why. An organization's mission statement describes what the group's going to do and why it's going to do that. So the new mission that I propose is to strengthen health promotion and wellness practices through outreach, provision of services, and ongoing education, and to improve community health. We want this mission statement to be similar to our vision statement, but it's more concrete and it's definitely more action-oriented than our vision statement. We want it to be concise, outcome-oriented, and inclusive. With the vision, we want this to be the dream. Your vision communicates what your organization believes are the ideal conditions for your community. So what do we believe? Healthy practices to promote healthy behaviors, individuals, and communities. This is how we would want things to look if the issue is important to us and if it was perfectly addressed. And by developing a vision statement, your organization or our organization will make the beliefs and governing principles of our organization clear to the greater community, which is very important in our situation. Also, we have our 5-year strategic plan going forward. I've broken this down into essentially 4 parts. I want to look at redefining who HCB is to the Brookfield community. I want to improve the financial dependency and establish a budget. We want to clarify leadership roles within HCB and promote opportunities for leadership internally and externally. We also want to increase collaboration with other state, local, and federal agencies. Underneath, you can see more of a smart action-oriented proposals or objectives for a 5-year strategic plan. But we want to ensure long-term community partnerships through the 9 guiding principles that I mentioned earlier, because each section evaluates items to consider prior to beginning engagement, what is necessary for engagement to occur, and what to consider for engagement to be successful. Furthermore, given the success of influential partnerships and how much it impacts the community public health actions that we do here at HCB, the constituency development's 4 practice elements will help us to specify the capacity required to support those tasks that must be carried out by this framework. All right. With an action plan, we want to look at what change will happen, who will do what, by when, and when will it happen. Its purpose is a detailed summary of how strategies and tactics will be implemented to accomplish objectives needed and developed. We will be going through a process of trying and testing and revising this multiple times. And feedback is very important, and it's key from community members, internal staff, external stakeholders, senior management, and so on. So with this in mind, I have developed an action plan here, and I've just highlighted a couple action steps, but I want to look more specifically at establishing leadership within HCB and among the community programmatically. So we have the persons responsible here, the director of public relations, program managers, executive director, etc. With this, I want to develop a team comprised of program managers and community outreach workers, where we will have 2-hour quarterly meetings and in a space dedicated for those meetings, where we will discuss topics such as constituency development, community engagement, and really actively involve those frameworks and guiding principles into our daily operations. Because prior to starting community engagement efforts, it's important for HCB to be clear about the purposes and goals of our engagement effort and the populations and communities HCB intends on engaging. Our efforts really need to have a narrow focus towards overall community improvement, including economic and infrastructure development, to contribute towards health improvement and disease prevention of Brookfield County. With a narrow focus, this will allow us to be better equipped to keep the programs that we have more directed and manageable in order to avoid community confusion about potential duplication of services. Also, in order for the community engagement to occur at all, the guiding principle of going into Brookfield County to establish relationships, build trust, work with formal and informal leadership, and seek commitment from community organizations and leaders will help create processes for mobilizing the community. And these should directly tie into our intent for our constituent development and engagement. Our current focus really needs to be refocused on the 4 practice elements that our organization is seeking relationships with these members, and we need to know the community and its constituents and its capabilities. We need to establish positions and strategies that guide our interactions with constituents. We need to build and sustain informal and formal networks to maintain these relationships, communicate messages, and leverage resources. And finally, we need to mobilize these communities and constituencies for decision making and social action. So with this and this team that will be comprised and having these quarterly meetings, they'll be able to go over this further in depth. They'll be able to go over the opportunities for HCB to become more actively involved in the community, which, as we've noted previously, is a very big concern of ours, and we want to have a better image with our community that we love and want to serve. So we can go over more action steps going forward, but I would just like to go over how we plan to evaluate this action plan. We want to go over this plan and make sure that these strategies are measurable. We want to set SMART goals. We want these to be achievable. We need to measure variables during implementation. By establishing the base values before strategy implementation, we can track the progress better. We want to continuously evaluate performance. With this, we can see the specific targets of measurable variables, and we can track these results of the strategy's performance. And finally, we want to review effectiveness of objectives and to what extent did our effectiveness in management reach the original goals set with the resources allocated. These are just a couple ideas about some evaluation possibilities that we can do with our action plan, with our 5-year strategies, etc. I want to conclude and go over some next steps. So in our presentation today, we went over who HCB actually is. We realized we're dedicated to promoting public health and wellness to Brookfield. We have a lot of room, though, to grow. We want to improve financially and programmatically. We want to focus on our accreditation with the Public Health Accreditation Board, with the local county public health department, and we need to eliminate this idea that HCB is a boat that does not have a navigation system and we're seeking a rudder and we don't have a sail. We want this leadership to be known internally and externally. So who do we want HCB to be? We want it to be financially sound. We want to develop that budget. We want a clear leadership, actively showing employee appreciation and understanding that all program needs need to be met, not just specific ones. We want to be actively involved in the community, and we want to establish a positive public image and purpose among our stakeholders and key community members. And with this, we hope that HCB's path will be guided forward by me, the executive director, through this presentation and ensuring the implementation of an action plan and proposed strategies. We want the board of directors to be actively involved to review and discuss revisions and additions to proposals. And we want senior management and program directors to implement the action steps that we present here today and go over further in the future and implement them into daily operations of HCB. We want to promote active participation and maintain leadership internally and externally. So with all of this being said, I know it was a lot to digest, but I would love to go over it further with you as the board of directors, and I would love to hear what you have to say about this proposal. Here are my references that I used, and if you have any further questions, feel free to reach out.